Welcome. Today we're diving into a fascinating yet relatively rare eye condition called Best disease, also known as Vitelliform Macular Dystrophy. This inherited disorder primarily affects the macula, the central part of the retina responsible for sharp, central vision. We'll explore what causes Best disease, how it affects the eye, and what can be done to manage it. Best disease is primarily caused by mutations in the BSD1 gene. This gene provides instructions for making a protein called bestrophin-1, which functions as a chloride channel in the retinal pigment epithelium, or RP. The RPE is a layer of cells beneath the photoreceptors in the retina, crucial for supporting their health and function. When the BEST1 gene is mutated, the bestrophin-1 protein is either abnormal or absent, disrupting the flow of chloride ions and other substances across the RPE. Best disease is typically inherited in an autosomal dominant pattern, meaning that only one copy of the mutated gene from either parent is sufficient to cause the disorder. However, spontaneous mutations can also occur, meaning a person can develop Best disease even without a family history. Let's delve deeper into what's happening inside the eye. The malfunctioning bestrophin-1 protein disrupts the normal function of the RPE. This leads to an accumulation of lipofuscin, a yellowish fatty pigment, between the RPE and the photoreceptors. This buildup forms a characteristic egg yolk-like lesion in the macula, giving the disease its distinctive name, Vitelliform Macular Dystrophy. Over time, this lesion can change, break down, and potentially lead to scarring, which can further impact vision. Best disease is considered a relatively rare condition. While precise prevalence data is limited, it's estimated to affect around 1 in 10,000 to 1 in 40,000 individuals. It typically manifests in childhood or adolescence, although onset can sometimes be delayed until adulthood. The disease affects both males and females equally and is found in various ethnic groups worldwide. The symptoms of Best disease can vary depending on the stage of the disease. In the early stages, some individuals may experience no noticeable vision problems. As the disease progresses, common symptoms include blurred vision, distorted vision, and difficulty with reading or other tasks requiring fine detail. Color vision may also be affected in some cases. The central blind spot or scotoma is also a characteristic symptom as the disease worsens. Because of the various stages, a patient with Best disease may experience a wide range of visual acuity. Diagnosing Best disease typically involves a comprehensive eye examination by an ophthalmologist or retinal specialist. Several diagnostic tests can help confirm the diagnosis. These include visual acuity testing to measure sharpness of vision, fundus photography to capture images of the retina, fluorescein angiography to assess blood vessel leakage in the retina, optical coherence tomography or OCT to create cross-sectional images of the macula, and electroculography or EOG, which measures the electrical activity of the RPE. Genetic testing can also be performed to identify mutations in the BSD1 gene, providing further confirmation of the diagnosis and aiding in genetic counseling. Best disease is generally classified into several stages based on the appearance of the lesion in the macula. These stages include the pre-vitelliform stage, where there may be subtle changes in the RPE, the vitelliform stage, characterized by the classic egg yolk-like lesion, the pseudohypopyon stage, where the lesion appears to separate into layers, the vital eruptive stage, where the lesion breaks up, and the atrophic stage, where the macula becomes atrophic or scarred. The progression through these stages can vary significantly between individuals. Currently, there is no cure for Best disease. Treatment focuses on managing symptoms and preventing further vision loss. In many cases, no specific treatment is necessary, especially in the early stages when vision is relatively unaffected. For individuals experiencing vision loss due to choroidal neovascularization, or CNV, which is the growth of abnormal blood vessels under the retina, anti-VEGF injections may be considered. These injections help to reduce the growth of these blood vessels and improve vision. Low vision aids, such as magnifying glasses and adaptive technology, can also be helpful for individuals with significant vision loss. Regular monitoring by an eye care professional is crucial to track the progression of the disease and manage any complications. As Best disease is a genetic disorder, there is no way to prevent it from occurring. However, genetic counseling can be beneficial for individuals with a family history of the disease who are considering having children. Genetic testing can help determine the risk of passing on the mutated BSD1 gene to future generations. Early diagnosis and regular eye exams are important for managing the condition and preventing further vision loss. The prognosis for individuals with Best disease varies. While the disease typically progresses slowly, some individuals may experience significant vision loss over time. Others may maintain relatively good central vision throughout their lives. Recent research efforts are focused on developing new therapies for Best disease, including gene therapy. Gene therapy aims to replace the mutated BEAST1 gene with a healthy copy, potentially restoring normal RPE function and preventing further vision loss. While still in the early stages of development, gene therapy holds promise as a potential treatment for Best disease in the future. Researchers are also working to better understand the underlying mechanisms of the disease and identify new targets for therapeutic intervention. We hope this overview has provided a better understanding of Best disease. Consult with your eye care professional for personalized advice and management of your condition.